Hi, I'm Dr. Peter Krakowiak. I'm an oral maxillofacial surgeon. I like to talk a little bit about rebuilding tissues and tissue engineering to allow for replacement of missing oral and dental structures. The area of tissue engineering has been a very interesting and very exciting area in medicine and surgery over the last 30 years. Oral maxillofacial surgery has also been a huge benefactor of the new technologies that have come to us in our quest to rebuild our patients' smiles and their structures of the head and neck. Some of the advances have allowed us to do things we couldn't do 20 or 30 years before, and now we're in the position to do that. Our practice has invested a lot of time, energy, and financially has structured our practice to be able to deliver the latest, the newest, the most predictable techniques for reconstructing your oral structures. Having the ability to do that allows us to have much more predictable outcomes in our dental implant therapy and also in replacing gum tissue as well as hard tissues in the mouth. We have the ability to do things that allow you now to have your teeth return back to, even in cases where severe bone loss and severe tissue loss has resulted in you being not a candidate for this treatment 10 or 15 years ago. We hope that we can get you back to where you were and utilize the abilities and also all the new developments that are out in the field of medicine in the setting of our practice. Oral maxillofacial surgeons are specialists in surgery. They are recognized specialists by both dentistry and medicine in the treatment of conditions that affect the head and neck as well as the oral structures. Oral surgeons uniquely go through a very lengthy training process which affords us expertise probably not found in any other field of medicine or dentistry. We first train as dentists, and that usually will take up to 8 years of college education. Subsequently, we apply and have to go through a very rigorous 4 to 6 year surgical program at a major trauma or medical center. Many doctors that complete oral maxillofacial training will also receive a medical degree in the process. We also rotate through anesthesia service where we deliver anesthesia care to patients in a hospital setting as well for well over half a year. That makes our expertise very broad in both medicine, anesthesia, surgery, and of course dentistry.